Government Ayurveda Medical College, Mysore recently had the honor of hosting a landmark continuing medical education program exclusively designed for the esteemed teachers of Samhita and Siddhanta. This impactful event, organized by our Department of Ayurveda Samhita and Siddhanta, was made possible through the generous sponsorship of the Ministry of AYUSH, Government of India, with the support of Rashtriya Ayurveda Vidyapeetha, New Delhi. We are delighted to share the complete recording of this week-long academic journey. Watch now to gain valuable insights from our distinguished speakers and relive the spirit of knowledge sharing and academic excellence. Now the session is led by our distinguished speaker, Dr. Shri Nagesh K.A. Sir. Dr. Nagesh completed his schooling at MVS in Shivamogga, followed by high school and pre-university education at Sacred Heart Institutions, Shivamogga. He pursued BAMS from ALN Rao Memorial Ayurvedic Medical College, Koppa, under RGHS Bengaluru, graduating in 2002. He further specialized with an MD in Samhita from Dr. BNM Rural Ayurvedic Medical College, Bijapur in 2007 and later enriched his academic credentials with an MA in Sanskrit from KSOU Mysore in 2013 and a PhD in Ayurveda from Tilak Maharashtra Vidyapeetha, Pune in 2017. In addition to his formal education, he has undertaken specialized training in manuscriptology, research methodology, biostatistics, educational methodology, and hospital management, reflecting his diverse academic and professional interests. His professional journey began as a lecturer at Bapuji Ayurvedic Medical College, Shivamogga. Since 2007, he has been serving as professor and head of the department at Sri College of Ayurvedic Science and Research, Bengaluru. Alongside his academic leadership, he carries a rich clinical experience of more than 22 years and has worked as a consultant in reputed Ayurvedic centers across Karnataka. Dr. Nagesh is also an active academician, serving as senior editor of JAIMS Journal and contributing as a member of several editorial boards, academic councils, and boards of studies.
When I joined PG, he was there as just like a guide for us, because we didn't know anything at that time. So we had Chate sir and other seniors also with us, and I cannot say no to sir when he asked me something. So it was inevitable for me to come over here. So he's very respected senior for me. And the topic which I have taken is the understanding and application of Indriyasthana. Here this topic that is about Indriyasthana is nothing new to you because you are the teacher, and this is my first time as a speaker for addressing the teachers of Samhita. Till now I have given presentations to many seminars or other events where there were students sitting, but this is a place where teachers are sitting. This is not easy for me. You can easily catch what I am telling wrong also. So this is a difficult situation for me. So I tried my best as much as possible to make it a little interesting also. Some known to you, of course, I tried to arrange it as much as possible. Okay, this is how I am going to do it. So let me start this with few experiences. Even I practice in the evening times now. I'm a regular teacher, and I'm practicing also. And during the practice, I have seen some of the cases where initially I could not recognize it as Arishta Lakshana. Later, I realized it is Arishta Lakshana. Many times it happened that I had seen that Arishta Lakshana, but later when I read it, I realized that was the Arishta Lakshana. So many such events, even you may also have faced it or experienced similar way. One thing, it happened during my third year BMS. It happened. Okay. Your volume kotri.
Volume, sir.
Is it audible or should I?
Yes, sir.
Yeah. So let me begin with one experience where I was in third year BMS when one of my senior was practicing in my place. He asked me to come over to see a patient. So I took all his instruments like BP apparatus and all, and I sat behind him, and he was driving the bicycle and I was sitting behind him. Some 4 kilometers away, the patient's house. So we went there. We went and saw that people or the family members, they were so scared. They are coming out, going in like that. They are quite anxious, and I could see that they had some of that anxiousness was visible in their face. We went and saw, and my senior was the one who was attending the patient. Patient was like almost pale, and her eyes were wide open, anxious she was also. And when my senior asked her about the situation and she was explaining what's happening, at that time she said that I can see the snakes roaming around over the roof. And it was like, it may be a simple hallucination she is getting. So we just ignored. Okay, she is very pale and her HP is very down. We have to give some treatment, something. They consulted one allopathy hospital and she was shifted to the hospital. There also we went there. And there we requested that allopathy doctor, can we continue our Ayurveda treatment? He said, okay, we can do that. We have to transfuse the blood now. You can definitely continue your medicine. So we came back and we thought of continuing it, and sir also, I think he suggested some of the medicines and blood was transfused also. Later, next morning I called my senior, sir, what has happened to that patient? No, she is no more. Then at that time it was like a realization, okay, what she was seeing, whether that was Arishta or what. That was one thing. Second thing was, we had continued the treatment. He had requested to continue the treatment. That was another one. So where we should have stopped it. The situation I will tell you. The challenges in knowing when to stop the treatment have made the treating doctors difficult to assess. We don't know when to stop it. When to start, okay, the patient comes, we have to start. When patient comes to consultation, maybe in Purva Rupa Avastha, Rupa Avastha, Nidana, at the level of Nidana, no one comes. They will consume the Nidana. Very few people come at the time of Purva Rupa. Of course, some who are very conscious about their health, they will come at the time of Purva Rupa. Otherwise, they will come at the Rupa Avastha only. Some over-conscious people come at the Upadrava level also. So they come like that. Okay, fine. But when to stop the treatment is a challenge. And non-contributing investigations and futile efforts. It is like we have seen that while treating the patients, it is like unnecessarily prolonging the treatment. We are subjecting the patients for so many investigations to find out any other thing we can do. We can do that scan, this scan we can do. We have to find out something. Regularly we are checking for some of the blood investigations and all like that. Doctors keep doing it, and it is unnecessarily prolonging the treatment, one thing. Second thing is, it is unnecessarily making patients to suffer. We are not prolonging their life, we are prolonging their suffering also. We are stretching their suffering also. We are not just making them to bring it out. The reason given was just to bring them out of that condition. True, we speak like that, we means doctors speak like that, but the thing is, when the patient is at the advanced stage or at the time of on the deathbed, we are unnecessarily prolonging their survival. Not just survival, we are prolonging their suffering also. So Indriyasthana is not just about knowing are they going to die soon. It is not so. Here what we understand, it is just about how much Ayu Pramana is left. For how long are they when are they going to die is not the thing here. It is about the survival duration, how much duration they have as for survival, and why is that necessary. One thing, when we get to know that patient does not have so much of time to survive, time of survival, then one thing we can do is, first of all, we can educate. And the thing is that many family caregivers report a poor understanding. dying person potentially adding the patient distress. We are adding to the patient distress that can be stopped or avoided. Second thing is the death anxiety, what we call. The patients, caregivers or the family members, we can make them aware of what is the situation they are going to face sooner, and they can be prepared. They can get to know where to stop. So some of the families, they simply take them from one hospital to another just in case he can survive. Okay, if the conditions are clearly given, clearly educated, we can definitely make them understand, and we can bring him out of the death anxiety. The death anxiety is like, it should not be a surprise for them. We should be able to educate them, and we should be able to tell them what is the situation, and should be prepared. We can avoid the financial loss also. We can avoid the death anxiety. We can cut short unnecessary suffering, unnecessary prolongation also. And also, many family caregivers report a poor understanding of the physical signs that occur in the last days and hours of life. Family members cannot recognize this situation. Whether the patient is going to die or whether he can survive or not, they cannot. They cannot recognize the death symptoms at least. So if we make them educate about some of the conditions, then at least in this situation you should be able to recognize this is that means they are nearing the death. So those things we can definitely do it. Difficult to answer, how long does the person or patient have? Family members ask, how much time does he have, or how much time do we have, so that we can be prepared. So there is no proper estimation for that. These Arishta Lakshanas or Indriyasthana in gross helps us to estimate how much time a person has. We can try something to develop one protocol. They have one scale in modern science. In Ayurveda we don't have any scale. We have only Indriyasthana with us. We need to work on that more, so that we can also develop one scale, so that we can also say that this much is a survival time duration. So we don't have it as of now. Clinicians are often inaccurate when addressing the questions about prognostication in patients approaching end of life, except for some clinical signs and symptoms. Of course, there is a scale which is rarely used, and otherwise it is like there are, based on the signs and symptoms, it is diagnosed. Near death symptoms are there are list of that. So based on that, presently prognostication is assessed. Otherwise the scale is rarely used, and often Arishta Lakshana are ignored, citing it is unscientific, or it is out of ignorance. It is said that okay, that doesn't carry weightage. But as far as the description given here, there are Niyata and Aniyata Arishtas, as you also know. So Niyata and Aniyata, there also we have that Purusha Ashrita, Purusha Anashrita, those descriptions come here. Here also it is like some symptoms are affirmative about the oncoming death, whereas remaining things are like it is more of an estimation that this can happen. It can be Rishtabhasa also, you know that. So Indriyasthana, you know, these have 12 chapters and placed before Chikitsasthana, and why it is before Chikitsasthana, you're all informed regarding that. So before going to the Chikitsa, it is about Ayu Pariksha we have to do. Even Sushruta also has explained about how much Ayu is remaining, whether your duration of treatment is less than the Ayu Pramana he has. If the person's survival time duration is 6 months or beyond 6 months, and your treatment duration is some 15 days or 30 days, it is still fine, you can do that. If the survival duration is only 1 week, and if you are prescribing medicine for 15 days, this is where we may fail to do that. So we may end up with Artha, Vidya, Yashohani, it is spoken, no? Such things we will end up with. So to avoid that, we can make use of these Indriyasthana. In the clinical examination, we have to make various examinations like Varna, even Sattva components, and based on the Ahara, Vihara, Vyadhi, Guru Rupa, Upadrava, Chaya, Pratichaya, Duta, on the way to the patient house, inside the patient house, everything is explained. All those are at the level of, at different levels we can assess it. If you have heard about Shakuna Shastra, Among all those, that's a very big one. Yesterday I was going through the Shakuna Shastra, how it is used. Some of the Shakunas are like, if cat crosses your way, it is generally understood. And if there is a lizard making sound when you are going to do some work, and if someone sneezes in between, it is very famous. We regularly do that. Among all these, related to the death, how much this is, how much it is relatable for our science, that much is made available in Indriyasthana. Shakuna Shastra is a big one. And many people follow that. Many people follow Jyotishya, Vastu. Shakuna Shastra is very famous. Here in Karnataka it is famous. I don't know in elsewhere also. If they are going for some auspicious, some work, if someone sneezes, then they avoid going there. If they are going to make some deal or going to purchase something, some property, at that time if cat crosses, okay, they cancel the whole thing. It is about not postponing the whole thing, they may cancel also. Many things happen like that. And if some people say a negative word while going for something, if they speak something negative, that also taken as inauspicious. So many people who are, in Kannada, Chate Vyavahara they say. For that, so numbering also, while speaking also they will be noting down what number you are speaking. If you watch in public places also, some number they will be hearing, they call it as, they take it as some clue for, what is that? They invest some money for so many things are there running. And are they just belief or will they definitely direct us? One thing is little ununderstandable is, who makes all this? Who is making all this? Who is the doer? We people are believing it fine, but let's imagine if you are going somewhere and if something happens and later when you move ahead ignoring it, and if it turns out to be a disaster, imagine.
So we will be telling our experience to them, and then we are only the doers, sir. Like we are only giving these knowledge to others, and they believe or they have that faith and they do the same thing. Because some or the other day the same thing would have happened with them also. So maybe that is...
Maybe like because of this thing. But it has come as a Shastra, no? Shakuna Shastra it has come. If you go and look at the bookshop, you will get a book for it. Shakuna Shastra is there. It may be experiences, but it has come as a Shastra. Shamsanadva, Shasanadva Shastra. It is there.
Some invisible entity has.
That's why the question is, okay, that may be that we have made it, we only have made it, we only have passed it through the legacy. That I had an experience, it may be true. Maybe. But here also, Niyata and Aniyata Arishta, when you are speaking about, like Purusha Ashritas are more of a reliable one, whereas Purusha Anashrita are not very reliable. It can turn out to be like Arishta or may not be Arishta also. Like if you are going to a patient's house, some inauspicious thing, if a tree has fallen on the way or it has fallen in front of you, if something has happened indicating that it is trying to avoid you going there. Okay, if it turns out to be true, is it like a dricha? Or else, if it is true, who is making all this? That's what is the question. Who is that? Who is the Karta? In Niyata Arishtas, in that Purusha Ashrita Arishtas, they are the doshas which are causing it. Doshas only are doing it. So that is reliable. Directly doshas are doing it. We have that in reference also we have. And doshas only are doing it. But out of that, who is doing it? If it is Purusha Anashrita, who is doing it is a question. That is not answered here. We get to see such things, of course. It can. That's why it is called Aniyata. It may turn out to be true, may not be. But if something auspicious, if you are going to do, and if something it turns out like that, something Shakuna or Arishta, like it is seen, who wants to take risk? Okay, if it is just something casually happened, you can ignore. Doesn't matter. And if it turns out to be true, that's why nobody takes the risk. Okay, let it be. Oh, it may be inauspicious only. I don't want to take the risk. This is how it is. Now it is going on. What is Arishta Lakshana? It is by which the death is predicted. The related shlokas I have displayed below. So these shlokas I am not going to explain. So for every explanation given above with the reference I have given it below. Okay. So Jayate Maranam Aneneti Gnanam Ayusho Antagatasya Lingam Nirnimittam Rishtamityuktam. Nirnimittam means here we don't find the reason for the death. For the development of Arishta Lakshana. So doshas only will be the reason for it. When doshas are vyapta throughout the sharira, that itself will be the reason for it. Otherwise, for the development of Arishta Lakshana, we don't get. That's why we don't get a reason. That's why nirnimittam it is said. Dosha brings in the Arishta Lakshana when it is spread across the body and has breached the limits of the treatment. See, there are sadhya sadhyata you have learnt. There is asadhya lakshanas are seen. Asadhyas are two in number, Yapta and Anupakrama. Let's take it as Anupakrama only. Whether Anupakrama or the Asadhya and Arishta, both are same or different. Of course, in Anupakrama only it should come. If it is in Sadhya Vyadhi, if Arishta Lakshana comes. Atyanta Viparya is there. What is the difference then?
The person survival could be extended, but here it will be near.
No, Sadhya Sadhyata is spoken about what? Is spoken about the Vyadhi. Whether Vyadhi is Sadhya or not, Sadhya Sadhyata is with respect to the Chikitsa it is spoken. Whereas Arishta Lakshana is spoken about the Ayu Praman. That is the difference between these two. This is spoken about the Ayu Praman. How much Ayu is left out? When is he going to die? It is, let's not speak it as a negative that when he is going to die. We can take it positively that what is a survival period. Like that also. So development of Arishta Lakshana does not have a specific causal factor and it is a time ripened, that is the time of death, when he is going to die, that is indicated. One more example that in the picture I have mentioned with a shloka. One person who was under treatment only for some renal failure, he was under treatment. And he was totally reluctant regarding any political discussions. He never had been to that. It may be state level politics, national level. He never had any interest in that. And he was admitted to a hospital because of the same, for maybe dialysis or something. And suddenly his son reported that my father started talking too much about politics. Suddenly, as if he is a political analyst, he started speaking, and we had never seen him speaking so much regarding any politics. It may be state. He started commenting on the government. He started commenting on some politician, local MLA, what that work, this work, that everything, which he had never discussed about. When he told that to me, I realized this is Arishta Lakshana. Because, okay, this is like it was like hallucination, like, or else some of the examples we have Smriti word is mentioned here. I will display that shloka. That he never had such things stored in his memory, but out of no way it is coming. So they are all like indicating that something must be wrong with him. And it turned out to be true also. Within 2 days he died. And his son came and told, don't know the reason of death. Can you tell? Because every week we are going for dialysis for the patient. This time also we went like that only. And I don't know why he died. And there was no cause of death mentioned. I mean, there is no precise cause of death mentioned there. So generally when there is no cause of death known, general statement they put is cardiac arrest. Now also many people die early. They die due to cardiac arrest, it is said. Now there are so many discussions are happening that early death is happening, in younger age it is happening. Puneet Rajkumar, so he died. He was physically fit. Whether Ati Vyayama is the reason, don't know. Whatever. The thing is about Ayu Pramana, how much it was left and how much anyone could assess or at least observe any Arishta Lakshanas developed. Because except for Ayurveda doctors here, Arishta Lakshana as of now separately it is not studied anywhere. Of course, near death symptoms, imminent death symptoms, they are there in modern science also. They took it along the signs and symptoms only general. Otherwise, separately as a sthana, separately as so much of importance is not given anywhere. So that we can see it in Indriyasthana only. The Rishta and Arishta both are same. It is used as synonyms. The Lakshanam Arishtam Syat Rishtam Api Abhidhiyate. So the both are used with the same meaning. The names used for the Arishta Lakshana in Indriyasthana are so many. Or death, not Arishta Lakshana. It is regarding the death, how many ways he has explained that Parasuhu, Vrajati, Antam Tasya Jivitam, Yamakshayam, Yatha Pretastata, like that. It is in vividly he has explained, he has taken the names, how it is, he is trying to define the death. So not going in deep about what it is, because each, the names or the synonyms when he is using, it is not just out of keeping a versatility, it is out of some reasons only, definitely. I didn't go through it in detail, why he is telling like that, Srodasariyate, Hanti, Asukshayaha. So each one could have different meanings. We'll, perhaps in some other session, we'll work on it. When to observe the Arishta Lakshana? So there are different places where at the arrival of the patient, while examining, when Duta comes on the way to patient house and the entry of patient's house, and there are general symptoms also. Generals are plenty are there. And why should be aware of it? Sadhya sadhya vibhagagno jnanapurvam chikitsakaha kale charvade karma yattat sadheti dhruvam artha vidya yashohani. So this description is for the treatment if we do for asadhya roga. Then, which I have made it in red, this is important. Anubandha kalu sa yaha kartaram avashyam anubadnati kuryat uttarakalam karya nimitta shubho va api ashubho va bhava. That means post-treatment, it can be shubha anubandha or ashubha anubandha. Anubandham khalvayu, you know that in Dashaveda Pariksha Bhava. Anubandham khalvayu. So that means it can be sukhayu, dukkhayu, hitayu, ahitayu, whatever you have done the treatment, outcome will be that anubandha, and we will be the one, the bishop is the one who is going to share the karma phala of that one. Hence we should be careful regarding that. So if you become the person treating at that time, or else in asadhya vyadhi, if you are trying to save the life, it is like stopping that atma to go out also, it is not a right thing to do. So if we do that also, whatever is the outcome will be, we will also be sharing it. It can be outside outcome also, like patient attendants may get angry. They may come and attack you, slap you, drag you to the court, whatever may happen. Everything, all these are anubandha only. And if you stop the treatment at that time, that will be like, okay, this doctor did not treat, at least he was treated elsewhere. Okay, this Ayurveda doctor is not the one who treated, and because of him, he didn't die. At least that is how it is reflected. I am not saying that anyways he is going to die and we had treated before. We didn't treat at that moment. That's what he is saying. Don't treat it at that moment. Asadhya when it is lakshanas when they are developing, or Arishta Lakshana when it is developing, at least avoid treating it. So beyond that level you should not be treating. So there is a threshold of that also. So it is, Vaidya will accumulate the papa and failures if he treats the patient with Arishta Lakshana. Relevance and importance of knowing Arishta Lakshana. The benefits of examination is to determine the executable treatment or response. Parikshayastu khalu prayojanam pratipatti jnanam pratipattir nama yo vikaro yatha pratipattavyaha tasya tatha anusthana jnana. So like the kala, the description of kala, it is given. It is nahi atipatita kalam aprapta kalam va beshajyam upayojyamanam yogikam bhavati. So atipatita kala, aprapta kala. In both the conditions, when the chikitsa used, is of no use. Hence it should be in a proper time only it has to be treated. If it is not at asyam avasthayam asya beshajasya kalaha asya beshajasya akalaha, when it is spoken, that means this is not a treatment, this is not the time for this treatment, this is not a, this is the time for this treatment. If we do not recognize that properly and if we treat it, that is where we are not following the Aushadha Kala, and that is how we are going to fall in that trap of that Anubandha. I mean, if it is a uncomfortable outcome if we are facing, so we are going to fall in the trap of that one. So we should be careful about that. Athura is the point of focus of treatment. Examination is for this treatment. So when not to treat also, we should be knowing it. So Arishta Lakshanas, not going to elaborate because these are the topics which you have already not studied, you have explained also perhaps. So Purusha Ashrita, Purusha Anashrita is the one cross classification, we get it in the initial pages. Later in the chapters we get other classifications also. So by Prakriti and Vikriti we have to make Pariksha, and Purusha Anashrita we have to do it by Yukti. And there is a Pariksha, there is a Prakriti description explained in Vimanasthana also. There is a Prakriti description explained in Indriyasthana also. What is the difference between those two? So Prakriti is explained in Vimanasthana. You know it. Which are those? You know? Shukra Shonita Prakritim, Kala Garbhasya Prakritim, Maturahar Vihara Prakritim, Panchabhuta Vikara Prakritim. In that, in these, Shukra Shonitam, Garbhashyastam, Atma Prakriti, Vikara Samochitam, you know. So that is mainly the Shukra Shonita Prakriti. So remaining all are also contributing to Shukra and Shonita only. So grossly it is Shukra Shonita Prakriti, they say in Vagbata also in first chapter it is said. Otherwise, Mahabhuta Vikara Prakriti is like which are all the items that Garbhini is seeing around, what type of person he is seeing. There is one example, I have observed one thing. One Garbhini was observing one small kid every day. And that was very cute, small kid. Every day, it was like with there only, it was roaming around there only. Every day that Garbhini was seeing. When the child was born, later, astonishingly, when his kid had grown to that age of that kid which he observed, this kid was identical to that one, looking identical with that one. That's why in our Shastra also, you should be, a Garbhini should be seeing husband only during the Garbhavastha. If she is seeing some Shah Rukh Khan or Salman Khan, then definitely there will be a conflict. So that's why Mahabhuta Vikara Prakriti is very influential. It is not very simply it is said that to become black or white, it is not just applicable to that. It is like exactly, it is like how you have to be. If you are seeing a photo of a Krishna or any Devi, so that should be, it should be seen. That should be visible there. And what you wear, it should be Shweta Vastra, it is spoken. Dark one should not be worn, it is spoken. Everything will influence because it is influencing the Mahabhuta. Mahabhuta Vikara Prakriti. So they are all about the formation of Garbha they are speaking. About the normalcy of the Prakriti. Whereas in Indriyasthana what Prakriti they have explained. It is Jati Prasakta, Kula Prasakta, Deshanupatini, Vayonupatini, Kalanupatini, Pratyatmaniyata, when they are telling, this is about Arishta Lakshanas. If the person, Jati Prasakta, as per the Jati he should be behaving. All of a sudden he starts a different type of behavior if he starts exhibiting. Kula Prasakta. In his Kula, in his family, what is the usual behavior? He is from the family of priest. His regular behavior is like their familial, how the legacy is, like that only he is behaving. All of a sudden he started behaving very wild. Out of that he is behaving. And another family is like a merchant family. He is into business, they are into business. All of a sudden he starts speaking spirituality. All of a sudden it should be. Not that he heard so many spiritual speeches, then he speaks. No, that is not Arishta. So all of a sudden it should, if it is. So they are all explained in Indriyasthana. That Prakriti, what it is spoken, they are like Jati Prasakta Adi, they have explained. They are coming under this one. If these are seen, these we see it as a Prakrita Parikshita as far as Arishta Lakshanas are concerned. So there are Mumurshu Lakshanas described generally as it is explained: loosened calf muscles, elevated nose, acute onset of fever, thirst. So symptoms are general, you know that they are the descriptions available already. Smashing the knees, raising the legs and smashing on the ground, gasping. So, Rishta Lakshanas, Purusha Anashrita, Purusha Samshrayani, Yuktitaha Pariksheta. These are Prakrititaha and Vikrititaha Pariksheta. And in Prakrititaha Pariksheta, as described, Jati Prasakta, Kula Prasakta, Deshanupatani Adi, and Vikriti Pariksha, Lakshana Nimitta, and Nimitta. So, these are all the what we discussed just now. In the Kalanupatani, it is cold, but he is roaming around naked, which is not natural. In very hot, he should be actually, he is some Shitopachara he should be doing, but he is doing the Ushnopachara instead of that. In Shita, he is getting profuse sweating. All these things should be like, as Arishta, it should be coming. It should not be like something, if someone is by his nature only, if he is very sweating, that is not, don't tell them that you have Arishta. We should not be telling them, it will be a conflict. Sorry. So, Vayanupatini, again, age-old person, if he suddenly starts behaving like a small kid, or a small kid behaving as if advising everyone as if he is a very elder, experienced person, both are unnatural. So, these are the striking points we have to observe in a person. Pratyatmaniyata, this is individual. A person has his own characteristic, his own behavioral pattern, if all of a sudden it changes. So, that is also little matter of concern, like that. So, Lakshana Nimitta Narupa, the Lakshanas of a disease exhibit as Arishta due to Daiva. Here Daivamsha is involved. Lakshana Nimitta is the Arishtas developed as a result of Nidanas explained. Then Nimitta Narupa, this Vaidya needs the Ayu Pramana Gnana, end of the Ayu itself is the reason here. So, descriptions are known to you. Arishta Lakshana as described in the contemporary sciences. Not uncommonly, actively dying individuals, regardless of their socio-economic status and cultural background, may report having dreams or some visual hallucinations, where they report seeing deceased loved ones, friends or family members. Even modern science also have noticed it, that there are some, like they call it as hallucination, of course. Patient must have reported that I can see the, like my lost family members, the people who lived earlier. So all those I could see. They also have noted. These strange experiences occur regardless of the underlying illness and are not related to medication adverse effects. Medication adverse effect also, that is also described here in Vamana Virechana related descriptions are also given in our Shastra, but here what they are telling, not related to medical adverse effect. So what hallucinations are, what they are producing, it was unrelatable to the treatment given, and also it do not have any link with underlying illness. Like that, it comes as a strange symptom only. These are actually published ones only that I have given that link. Jagrat pashyati yan preta rakshamsi vividhani cha anyadvapi adbhutam kinchin nasat jeevitum arhati. This is what I said. The patient started recognizing his deceased ancestors around him, dies off in 3 days. This also, there was a patient seeing that. That patient was 97 years old. He was in ICU. We were permitted to see that person. We went and saw. We were standing here. That patient was making namaskara elsewhere. Why we are standing here? And he is elder to us. Why should he do namaskara for us? But he was doing namaskara. And it was like doctor said, at this age they will get all these hallucinations, they said. But fortunately I had read Arishta Lakshana, Indriyasthana at that time. I said the attendants of that patient that I don't believe he is going to survive anymore because he has already seen some ancestors. He told actually, I can see my father. He himself is 97 years old. He is seeing his father. He is seeing his grandfather. And he is doing namaskara to him. So that was the one striking point. And he died within 3 days. So that's how It is actually much more clearer actually. You can see that all those, it is looking like a demons. They don't see the demons, they see the ancestors. Okay. Terminal lucidity. So, example I gave, a patient without any interest in politics. He started speaking about politics all of a sudden out of nowhere. So, a dying person who often is less responsive or even comatose at this period suddenly becomes awake. Just like a simile is in Kannada, it is given like before the lamp extinguishes, it burns brighter. In the same way, it is terminal lucidity. So awake and alert with unexplained increased energy. All of a sudden they become energetic. All of a sudden he becomes normal. So during our internship, my internship, one patient with tuberculosis, pulmonary tuberculosis. It was like we were very happy that we gave treatment for one day. He had pulmonary tuberculosis. He was like on deathbed. We gave some treatment and next day he was like sitting and drinking the juice. We were so happy. We went and reported our sir, our treatment worked wonders. He is sitting and drinking the juice. Later we could see that he is walking around, he himself going to toilet and coming out. We were so happy, we were so confident. Next morning we came to duty, that bed was empty. That's what it is said, unexplained increased energy and may engage in meaningful conversation also. That patient was so okay, when can I go home, like that he's asking. We were so enthusiastic that okay, you are already out of the problem, we can go anytime, let doctor say. Next morning he went, but not to his home. When we went and asked sir, where is that patient? Did you refer him elsewhere? No, at early morning he died. They took his body. We were like looking at each other's face, what had happened yesterday, our treatment had worked wonders. It was Arishta Lakshana actually. Like that happens. Studies showed that 84% of people who experience terminal lucidity usually die within a week, with 43% dying within 24 hours. So it happened also, and this is not uncommon. And usually in our hospitals, we don't get terminally ill patients generally, especially in Ayurveda hospitals, rarely we get. In some of the hospitals like medical college hospitals or general hospitals, where death is very regular. Even in Bengaluru Victoria Hospital, like per day there are 20 autopsy they do. Per day they do. In that one hospital, there are multiple hospitals like that. Perhaps we could able to see the Arishta Lakshanas if we make a follow-up there. If we make a study, collect the data, we can accumulate some data and prepare a report saying that these are the Arishta Lakshanas we observed, and based on that we can assess the time of survival also if possible. So we can generate something, but which is an area of research. First ever recording of movement, someone dies, revealed what our final thoughts could be. This was actually published in last year, I think December at that time, that in Vancouver, Canada, researchers took the look at the brain of 87-year-old patient suffering from epilepsy, but he unexpectedly died of cardiac arrest while they were observing him. At that time, in the EEG, that is electroencephalogram, they were able to determine what was happening in his brain. That is, they could see the flashes before their eyes, and it was like gamma oscillations they had detected in that EEG. And gamma oscillations are linked to the retrieval of memories and dreaming, which might suggest the patient was actually reliving the past experience. The patient was actually getting all those memories, what he had lived. So at the time of death, all these like gamma oscillations it was observed, like a flash of light it was observed. Like that they said. And in the journal it is said, through generating oscillations involved in memory retrieval, the brain may be playing a last recall of important life events just before the death. Similar to the ones reported in the near-death experiences. So these findings challenge our understanding of when exactly life ends and generate important subsequent questions. So our Indriyasthana, I think, contribute a lot regarding this one. As we know that this is the reported one, idamagam siddhatvat pratyaksha phaladarshanat mantravat samprayoktavyam nam imamsa kadachana, it is said. So they are saying that there is a finding challenges to our understanding. It may open up the avenues for research further, but our Indriyasthana is ready for that, to be frank. So we have information recorded already so that we can make a research on that one and tally with existing descriptions available and come out with a good protocol of assessment scale for survival duration. This is the AI generated image actually, saying that patient was seeing the snake on the deathbed. This was that boy actually, what I told about. I didn't tell that. A boy of 17 years old, he had a habit of smoking since 5 years. Since 5 years. He was a boy of 17 years. Since the age of 12, he was smoking. Per day, some 20 cigarettes he was smoking. He was not a native of Karnataka, but he was in Karnataka. He was native of elsewhere, but he got some into bad friends and he learned that also. At the age of 17, he died. Before death, he had seen that snakes on the roof, and also at one point of time he said that there are mouse everywhere. It may fall on us. On the walls it is climbing like that. We were like seeing what actually he is seeing, but there was nothing there in his room. All his friends, his brother was sitting beside him and saying that there is nothing like that, why are you telling? No, can you see that mouse? That brother came and told me that this is how he is saying what to do. His body had become so dry, just like Basma Sura. Basma he has applied, like that dry it was. So I told him, okay, at least Snehanam we can do something, do Abhyanga, give some Grita. No, doctor has said not to give Grita something, anything. Okay, do something. At that time this Lakshanas developed, that mouse and snakes. Okay, then it is done. Within a day he died at the age of 17. Arishta Lakshana, inimitability. That is what is the exclusivity of this one. So it is given here that Swasthanam Aturanam Vapurushanam Dehantara Abhilashinam Aushadha Vishya Atitaha. So Aushadha Vishya Atita, when they have crossed the limit of the scope of treatment. So it is given here as both Swastha and Atura. I didn't see in any Swastha as such. But one thing, a normal death, the patient, when the age-old patient, when he is going to die, at that time also we get to see the symptoms we have heard. I didn't see any cases as such, the normal person developing Arishta Lakshana and death. If someone has died in early age, perhaps at the time of death also, in one Kshana, the Arishta Lakshana would develop and he may die. Like such descriptions we get. Perhaps it could be true also. But we don't usually observe such things in a normal person living. The person, if you happen to observe it and record it, and the person has died, and that could be one the recorded could be recorded as Arishta Lakshana perhaps. Arishta Lakshana indicates that the condition is beyond the scope of treatment. So asadhya vyadhi, where chikitsa is not explained in our Shastra. The person is living, he didn't die immediately of course, but that disease does not have any treatment available. But here Arishta Lakshana is, anyways it is asadhya only, one thing. Second thing is he is developing the death symptoms. Arishta Lakshanas are produced when dosha spreads throughout the body. So where the dosha, these niyata arishtas are purusha ashrita arishtas, where doshas have spread across the body, those doshas only are developing these symptoms. Arishta Lakshana indicates the diminution of the life expectancy, and man develops the swabhava viparyaya, sudden altered nature in himself. This, if you have observed the person since long, that he has this type of behavior, or this is the nature of the person, and suddenly if you have observed that the change or a sudden drastic change in his behavior pattern, then that could be a symptom. The Arishta Lakshanas would be seen in Kala Mrityu. Here it is said like that. Elsewhere, Kala and Akala Mrityu, both it is applicable, it is described in one more place, one more opinion. Kala Mrityu, it is like, it is evidently available. Akala Mrityu, at that time, it is at a fraction of a second, it may develop and go, of course. We may fail to recognize also. But generally, Sarvameva Rishtam Kala Mrityoho Param Bhavanti iti Varnayanti, like that Chakrapani says. Later we get one more description where it is applicable to both, it is said. So Niyata and Aniyata, two are there. Niyata is where death is evident. However, in Aniyata, the condition will be suspicious and would get pacified by the treatment. Here, for Aniyata, we have some of the treatments also mentioned. Then why is it called Arishta? Why is it called like Antagatasya Lingam then? So there are some like Rasayana you can give and you can compensate it and you can bring him out. Such descriptions we get. The Rishta Lakshanas are either with the Vyadhi or without. With the Vyadhi or without. So with the Vyadhi we have some descriptions in Indriyasthana 5th chapter where the diseases are associated with, Arishta Lakshanas are associated with some background disease and some conditions are not with the background of any disease also. Both conditions are available. For Avyadita also. Arogana Punastvetat Shatratram Paramuchate. Here, if you have observed in Marma, description of Marma, we have Satya Pranahara, Kalantara Pranahara, and other type of Vishalyakna, Vaikalyakara Marmas are there. So, in the description of Trimarmiya Siddhi, it is mentioned that Skandashita Marma, Shakashita Marmas. So, Shakashita Marmas are not Pranahara Marmas. All Pranahara Marmas are in the Skandashita they are. So, that is in the middle of the body only it is they are present. Near the Koshta only, near the Marmas only, Maha Marmas only are present. And these Skandashita Marmas are actually, they are interlinked, all Marmas of course. Shakashita Marmas are connected to the Skandashita Marmas. Skandashita Marmas are in turn connected to the three Marmas. So like that it is described. And here, with the description, classification of Sadhya Pranahara and Kalantara Pranahara Marmas are actually with a little distance from the Sadhya Pranahara Marmas. From a little distance. What we can understand out of it, Sadhya Pranahara Marma, when the dosha reaches, then there is a duration of 7 days when the person may die. Whereas Kalantara Pranahara Marma, we have got a month of duration, 6 months of duration, one year of duration. That means it is understandable that when the dosha reaches Kalantara Pranahara Marma, it takes about that much of time of 6 months, 1 month or 1 year to reach Sadhya Pranahara Marma. When it reaches Sadhya Pranahara Marma, then it has got only the 7 days of duration of death. At that time, we have got the terminal stage of that life, and at that moment, these Arishta Lakshanas may develop. So, this could be the precision perhaps for the duration when the Arishta Lakshanas might develop. Whether a person will die once Arishta Lakshanas develop, here again there is one more classification, Sthira and Asthira. Sthira Arishta Lakshanas are developed by the doshas, which will be subsided by this is the description given here. Krishna Treya is the one who speaks about this one. So even that can also be treated, he says. There is one deviation in the description actually. That way, if it is Arishta Lakshana, we have a description in our Charaka also, that once Arishta Lakshana develops, it does not go off without death. It is said. But here it is one place it is said that if it is dosha, it can be subsided by Shamana. Sometimes by the profuse dosha, symptoms mimic Arishta, called as Rishta Bhasa also, he says. Perhaps Aniyata Arishta he is speaking about. Death may be avoided by certain procedures like Rasayana, Tapa, Dana, etc. That is explained. This description, we get it in Ashtanga Sangraha, where he takes a cross reference of Krishnatreya. Doshanam api bahulyat Rishta Bhasa samudbhavet tad doshanam shamesham yet sthai avashyam tu mrutyave. Sthai will be actually by the doshas he says, but Sthai according to Ashtanga Sangraha, it is going to end in the death only, like that he says. Dhruvam hirishte maranam brahmanaihi tat kilamalaihi rasayana tapodana tapa tatparaishcha nivaryate. So rasayana, tapa, dana, these are the things which can counter this. It is given here in Sangraha. Arishtam nasti maranam drishtarishtam cha jeevitam arishte rishta vijnanam nacha rishte api anaipunyat. As per Charaka, once Arishta Lakshana develops, it ends with the death always. Death happens with preceding Arishta Lakshanas always. This is according to Charaka, he says. That means every death has got a Arishta Lakshana as a Pura Rupa. Why it is called as Lakshana then? Pura Rupa. While understanding the Pura Rupa descriptions, if you have observed, Arishta Lakshanas are said to be the Pura Rupa of Marana. That means it is going to end with that Rupa, that is death only. That is Charaka's description. And no Arishta Lakshana will go off without a death, he says. There is a difference of opinion we could see, but some Aniyata, Niyata, Rishta Bhasa, these descriptions also we get to see. Duta, Arishta, etc. Arishtas are Aniyata Arishta. Like the person who is coming to you, who is wearing a dirty cloth or torn cloth, and he is like he didn't comb his hair, they are Aniyata, they say. Maybe he is an informer or he is the person who came to receive you to the patient's place. Maybe he could not afford time to wear a good cloth. That could be the logic for assessing the Arishta Lakshanas, but that cannot be the absolute reason. That's why it is called Aniyata. What if he did not get any shirt to wear? Of course, if he is traveling on donkey, it is given. Nobody travels in donkey nowadays. He may run to you. And if he is anxious, as some people are, for a small thing also they get anxious. We cannot call it as Arishta Lakshana at that time. There is no grave situation at his place, but he exhibits. So, just like a Guru Vadita, Lagu Vadita, your descriptions you have seen. Like that he is exhibiting unnecessarily. That can also be. So it could be Aniyata. Cannot be fully dependable. So that we cannot say that all Pravara Sattva person only comes as a Duta. We cannot say. Avara Sattva also can come. So they may be too scared about the condition. And just because the person who is ill, he is very close to him, that's why he is so scared. It can also be that. So the logic based it is spoken. So this is quite Aniyata, they say. Bodily symptoms are said to be doshaja, which are niyata arishta, because doshas only are producing it, and doshas spread across the body and they are producing it. Though aniyata arishtas are explained, purusha anashrita are uncertain, and symptoms produced by dosha are certain in ending in death. Like that we get a description. In that description of arishta also, it is dosha kurvanti, like that only we get a description. That means the Arishta Lakshanas, that is Purusha Ashrita, are produced by the doshas only. So we don't have the information who produces Purusha Anashrita Arishtas. Purusha Ashrita Arishtas are by doshas only. Anashritas we don't have. That's why Shakuna Shastra I spoke about. So where it is about more of a bad or good omen, what we observe. So it depends mainly on that one. In current medical scenario, combinations of the patient's performance status with clinical signs and symptoms along with the clinician's estimate provide a more accurate guide for survival prediction in terminally ill patients. So we have so many criteria to assess whether the person is terminally ill or is going to die. So there are criteria here. The study demonstrated that a confused mental state, decreased conscious level, death rattle, decreased blood pressure, low oxygen saturation are some of the significant changes that occurred in the 48 hours preceding the death. They are the scientific parameters they observe. Like whether the BP is coming down, whether that oxygen saturation is coming down, they are all the scientific parameters they do. They are not like, they are the investigation based we do. Otherwise, signs and symptoms when we come to without any investigation, so our Arishta Lakshanas help us. 92% of terminally ill patients develop death rattle in the final days of life. death rattle is stronger predictor of imminent death, and nearly 80% of people die within 48 hours. How medical science sees the signs of imminent death as these bedside signs like non-reactive pupil, decreased response to visual stimuli, inability to close eyelids, stimuli like you can ask about your identity. What's my name? Can you identify me? Like that they ask. So if the person says, identifies, then okay, it is his, condition is that not that bad. Index, Glasgow prognostic score are reliable and validated tools that can be used for HCPs in any healthcare settings. And this palliative performance scale is the one which is grossly used. And here it uses 5 observer rated domains that include ambulation, activity, extent of disease, self-care, intake and the conscious level. So these are actually, there are 5 domains classified into 11 categories based on 10 points each. So with the percentage wise they do, and if it is 0, it is about 0 means it is death, and 100% means their person is completely healthier. So based on that they have made a scale. Findings showed the PPS and survival time in cancer patients were significantly correlated. Cancer patients with PPS 10%, 20, 30, 40, and 60 and 70 to 80% had median survival time. Median survival time, this is again central tendency they have calculated, 2, 6, 13, 39 and 95 days respectively, while non-cancer patients with PPS 10%, 20, 30 had a median survival time of 8, 6 and 24 days respectively. Like that they have a median time of survival. This is palliative performance scale, where this is the percentage they have made it, and this is ambulation, these are the self-care, conscious level, they are the different 5 points they have made it, and out of that estimated median survival days they have mentioned. This ABC is not described, it is maybe the groups they have made it, and if it is 0, it is indicating the death. If it is 10%, 20, 30, they are all bed bound, whereas here 40, 50 are mainly in bed or sit or lying. 60, 70 they have reduced, 80 full, 90 full and 100% full. They are full means they are healthier, towards healthy. Who is responsible for the development of Arishta Lakshanas? As we discussed now, doshas are responsible for development of Arishta Lakshanas. Arishta Lakshanas are relevant in both, this is what I said, Kala and Akala Mrityu, both it is applicable. Akala Mrityu cha yadeva kriyapatam atikranto apachara janito vadir bhavati tadeva paramrishtam bhavati. If it is Akala Mrityu, if the treatment, if the condition crosses beyond the scope of the treatment, then it develops, otherwise it does not. Like that it is spoken. Kshanena hi rishtani pradurbhavanti iti. So very momentarily it may come for a fraction of second or a time, very short period, he may develop Arishta Lakshanas and he may die off. So we may not be able to observe also at that moment. If we are there, if we can observe it, then only it is possible. Otherwise, at the very last moment, if he is developing Arishta Lakshana, we may fail to observe also. In Akala Mrityu, when by the bad deeds, when the doshas breach the scope of treatment, so doshas produce the Arishta Lakshana. In Akala Mrityu also, here it is the doshas only are produced. In fact, apart from the conventional ruksha, etc. reasonings, doshas produce the Arishta Lakshanas by prabhava. So, why these doshas produce the Arishta Lakshanas? Instead of producing only Vriddhi Lakshanas, Kopa Lakshanas, Prakopita Vayu, Pitta Lakshanas, we have it. How it can produce Arishta Lakshanas? That is given as a prabhava. That is because of the prabhava. Dynamism of Arishta Lakshana. Dynamism means here the duration, how much it takes for, that is described vividly. Development of Arishta Lakshana indicate the specific or maximum duration of survival vanishing of specific desires, visual attires, memory, intellect and physical strength unpredictably. So here this is important, unpredictably if it is happening. Usual specific desires, he is very fond of something and he suddenly gets totally distracted from it, or he starts disliking it. Some are fond of coffee all the time. They cannot survive without coffee. If you tell them to change that habit, they prefer to change the doctor instead of it coffee. I have seen many people who need coffee early in the morning. Maybe you are also there perhaps. So without coffee they cannot survive that day. They need coffee. After that, okay, rest you can tell whatever I will do, but I need a coffee in the morning. If you tell them to do that, then okay, I will go to some other doctor instead of you. So sudden changeover, sudden disliking of the coffee. Today, till yesterday he took 10 coffees per day. Today he does not like. Unpredictable, sudden change of their desires, usual specific desires. Usual attires, memory, intellect, physical strength, all these. As a weak person, suddenly he becomes very strong. Suddenly he tries to climb a tree. In villages it happens. They usually, who are farmers, who are taking care of their field, like areca plantation they do, they cannot climb, it is very high, about 160 to 80 meters high the trees are. Usually a common person cannot climb on that. If he tries to climb on that also, people are there. At the very old age, sudden change of such behavior also. Sudden surge in their physical strength. We could see that. One patient who was comatose since 15 days, it was like suddenly he got up, he asked for some food. It was like, okay, I prayed for the God, suddenly he got up. I think my prayers were heard. No, heard of course, but he is going. He got up of course, but he is going. So one day of survival. This happened in one place in village when he was lying down since 15 days. Coma. He was in coma. And God heard that he got up yesterday. I think he is fine. No, he is not fine. Next day he died. So it is like a sudden surge of their energy, sudden surge in their Indriya's strength when they could see anything, like they were using the spectacles always, they can see everything without a spectacle. Such sudden transformation, that is very dangerous. Appearance of prominent veins, crescent shaped appearance on the forehead indicates the maximum duration of survival as 6 months. Like that, the duration, that is the dynamism explained. Tremors, distorted gait, irrelevant speech, mimicking the intoxication. So that means compared to that dynamism of 6 months, compared to this looks more grave. Tremors, irrelevant speech, and drying or swelling of the limbs and face, sparing the rest of the body, indicates the duration is 1 month. 12 months of survival. Different sleep-wake patterns, little appetite. This looks like, many of these looks like a usual symptom in a patient, right? But it is listed as the survival duration of 12 months. May not be applicable everywhere, of course. Little uncertain, I can say this is my experience, because this more pain, little appetite and thirst is very usually we get to see in the patients. So we cannot say that they are going to survive for 12 months. Signs of 6 months of survival: progressive fatigue, loss of appetite, emaciation, social withdrawal. 3 months of survival: feel weak, become less active, sleep or doze more, eat and drink less, often preferring soft foods, withdraw from people and stop doing things they used to enjoy, talk less. They are going to end within 3 months. So there are imminent, that is sudden, Sadhyomaraniya Lakshana also, which you know. Advanced prognostic modeling. Flies sit on the body even after bath and sparing the body with lepa. You know that the Gomya Churniyam, it is explained. Dreaming of drinking the sneha with hangman or executioner. Worsening of the complications of prameha. Worsening or deepening of the prameha pidakas. This is one effort we try to develop with the similar scale of that PPS model in the same way, but percentage wise it is a 0, 25, 50 and 100. So it is bed bound or it can be death also. So Arishta Lakshanas are developed here, Upadrava, Rupa, Pura Rupa level. So but this cannot be said as, he can be normal also. There is that one point is missing here, that it can be normal also. Here it can be death added. So here also with the different scales we can try to work on with the minimum, these informations. That is total care we have to take it here. Assistance needed, it is self-care, he can take fully. Like that we can develop a scale with the existing informations and observed values in patients. Connotation are primarily focused on the physician's safety than patient's convenience. Of course, patient convenience is also there because there is a financial component involved. We can take care of that. And death anxiety, as I said, that can be prevented. But here about care is taken more for the physician safety also. Because patient is going to die. Of course, the person surviving is the doctor. So it is about the safety. And physician who observes the Arishta Lakshana will be legal. In practice. This may not be a right word to describe it, but it is the legal way of approach. A physician can attain the benefits of Ayurveda by knowledge of Ayu Praman. Here, can we outrightly say that I am not going to treat? We cannot. We should not be doing it. There are ethics also to say that. So we cannot outrightly say that these Arishta Lakshanas have developed, I won't treat. You cannot outrightly say. Even in Asadhya Lakshanas, we cannot do that. We have to be little take care of those emotions also. We should not be the reason for the increase in their anxiety levels also, and we should not be so blunt in answering it. We should be careful while conveying the information, or else we should be diverting them to a higher center. Something like that we have to manage. Importance of identifying Arishta is focused to indicate the stoppage of the treatment. So Arishta Lakshana, even in Asadhya Vyadhi, we try to give the treatment, but when Arishta Lakshana develops, it is the time to stop the treatment. So, you know that Asadhyas are two types, that is Yapya and Anupakrama. Yapya has got medicine. Anupakrama do not have medicine at all. But if Anupakrama cases come to us, we can treat, of course, though it is not a treatment, and Dosha Pratyanika at least we can do. Definitely we can try, of course, but if Arishta Lakshana is developed, that is the time for stoppage of the treatment. You should not be doing, even if you can use your yukti, everything in Asadhya condition also, you may try doing it, but when Arishta Lakshana is developed, stop it. Unnecessary prolongation of the treatment will be avoided, thus suffering is not prolonged also. This we have discussed already. Financial implications of the family can be avoided by avoiding unnecessary continuation of treatment. Simply putting IV, simply subjecting them for observation, or putting them in ICU, simply putting them the ventilator, pulling their duration of survival. We can avoid all these things if Arishta Lakshanas have developed. It is always useful to convey positively that this is the end of the treatment. It is better not to continue the treatment. Assessing the Arishta Lakshana might help in evaluating the time of organ donation also. It is not that Arishta Lakshana develop, you take out the organ immediately, because he didn't die yet. But here in modern science, usually the time of organ donation is the brain dead cases also they do, where heart is still doing its job. So brain dead cases, at times they say that okay, it is a death declaration they do, or else organ donation can be done. Few organs you cannot take it after death also, so they do it at the brain death level. But here, these Arishta Lakshanas will help us to estimate or evaluate when can we be prepared for the organ donation. So immediately we can take it out soon after the death if possible. So that arrangement also it can contribute for. General medical ethics while observing the Arishta Lakshana. A Vaidya who has realized the Arishta Lakshana shall refrain from treating the patient any further. This you know already. Then while doctor has observed the signs of death, he must not reveal it unless asked. This is one thing. That is, information is for you, not to tell them outrightly that he is going to die. Even while asked, the patient must, a Vaidya must refrain from revealing if it can worsen the patient's condition. If it is, he is going to die in 3 days, if you tell them, then he will die today itself. So, refrain from telling that so. Or it may, if it is bringing some pain to someone, a sudden open, if you open that information, some may get a chest pain, some may get a cardiac arrest. So, such things you should take care while revealing the situation. If patient develops the symptoms opposite to the death, Vaidya must inform without fail. If the patient shows the signs of recovery, unless for that terminal lucidity, unless for that at the last moment it is surgical, don't tell that he is recovering. Don't tell that, you should be aware of that. Apart from that, if he is showing the signs of recovery, you must immediately tell. But if it is a death symptom, don't outrightly say that. So take care of that. When the Vaidya observes the signs of death in a patient, he must neither eat nor drink anything in that at that location. What is the logic behind this one? Why he must not drink or eat something at that place?
Energy.
Could be energy.
So emotions are.
It could be emotions, because at the place of death, usually nobody goes and eats something. When someone has died, when we go to attend or extend our last salutations, we don't eat or drink there. But here it is signs of death. It is not death itself.
To be there present for the patient.
Sorry?
To be there for the patient if he is eating or drinking something.
Oh, what's there? We can drink and still be there only. No? Huh?
Maybe the food be poison.
May not be. No, it is just talking about, you cannot suspect something is poison there. Something. Huh? Krimi in what way?
Person who is about to die.
No, if the person is dying because of infection.
No, not dying, but the person is about to die. There are chances there are some Rashtriya that started attacking or eating the substances from the body, and their manifestation starts. So
Perhaps.
avoid to drink or eat anything from that place.
Family members might speak, though the patient was dying on deathbed, doctor came and had food.
Maybe some of the emotional component, as you said, it is possible that it may have an impact, one thing. Second thing is, if signs of death in a patient is observed, don't think that only Vaidya must have observed it. Those family members also might have observed it. It is not right to do that, eat or drink at that place. Vaidyas? If it is okay for the Vaidya, if his mental status is good, if he is feeling thirsty, usually it is ethics only, not to drink. It is not ideal to do those things. It is not a place or time to have anything. That is one thing. Or it can be like he is drinking or eating at that place when others also might have observed that death, signs of death also at that point. Or it can be like energies, as you have said. Probably that all could be the reason. But that logic is not given here. Now don't observe only negative things, observe some positive things also. Don't see only negative things around. When we have studied Indriyasthana, we are seeing everywhere bad omens only. No, there are good omens also, indicating that you can go ahead with the treatment also. While going on the way to the Duta is taking you to the patient's place, you may see so many good things also. Observe the opposite signs of Arishta. Suggesting that you are safe enough to continue the treatment. And Duta who is happy wearing clean white cloth, if it is there, okay, that is also. Now the thing is, the question is, on the way, if Duta is looking bad, but on the way signs are good, you have to observe that also. If the patient is wearing very dirty clothes, but on the way you are getting the auspicious things also, possible. So look at those things, signs also came during auspicious nakshatra. If the patient is like, he is having that, he didn't comb the hair, of course he may not have got the comb at all to comb, or else he don't have hair to comb. Not coming during noon, midnight, earthquake, eclipse, without any auspicious signs. See, at the time of earthquake, eclipse means at that time nobody will run to the doctor, they will escape to survive. Instead of that, they have come to the doctor, means it is like something grave situation. But if it is not so, then understand that there are positive signs also. Without any auspicious signs, welcome by Vriddha, single cow, Purna Kumbha, white flags, fruits, and pleasing things are seen on the way, hearing good sounds, bands also, pleasing birds, Veda Shabdas are heard on the way. So if one sign is suggesting negative, if another 10 signs are suggesting positive, count that. So we should be aware of positive things also. Don't focus only on the negative things. Coming to the conclusion, even though it might be challenging to predict when a person will pass away, being able to recognize the warning signs and symptoms of impending death is in terminally ill patients may help anticipate care needs. How much care? What is the plan of remaining time? How we can plan the care? For that, it would contribute early and better plan to provide individualized care, which will ultimately lead to better end life care. Better end life care, that is, this Arishta Lakshanas can contribute, this Indriyasthana contributes for it, and a better bereavement adjustment experience for the families. It is not something surprising. They have a breathing space, they can prepare some of the things, they can organize at least, they can call their relatives. Additionally, published research shows that when dying individuals are able to plan for their end life, they are shielded from death anxiety. At least if they are aware of it, they know that he is going to die. At that time, there is no death anxiety, at least because it is known to them. They are informed about oncoming death, so death anxiety can be prevented. Avoidance of unnecessary financial loss, which may be ensured by early estimation of duration of survival. You can plan for how much, whether should I continue with this treatment or not. Should I take him to some other higher center or not? If you take it to some other higher center, definitely they will restart all the process of investigations and all unnecessary burden. And should you definitely go for it or not? This will contribute for such decisions also. Estimated average duration of survival would help us to plan for the organ donation, as we discussed. And avoidance of unnecessary prolongation of suffering. It is not prolongation of the survival, prolongation of suffering also. So, if you have put the ventilator, it is not something comfortable definitely for the patient. Instead of suffering with all these, may I prefer the death itself, some people say. So, unnecessary prolongation you can avoid at least. So, citation. Thank you. Sorry? Ayu Pariksha is given, no sir, in actually at the time of birth only it is given. And also Uttama Ayu, Madhyama Ayu, Alpayu Lakshanas are there. Like the hands are till Ajanu Bahu they call in Kannada. That is described in this one, Sushruta only. That is in that Vrana Prashna, I think, in that chapter. It is asked only. And also Dirghayu Lakshanas are there. Some are applicable at the time of birth, some are applicable even after, not only in at the time of birth, post birth also. And also asadhya lakshanas we can do. Sadhya, sadhya lakshanas we see. So based on that also the status of that prognostication we can do. So all those things. Ayu Pariksha as such, we do it initially at the time of birth, later at the time of taking the case. That is also in Sushruta it is described. So whether they have these Indriya related symptoms and disease, severity of the disease, there are certain criteria mentioned. Based on that, these are calculated. Grossly, it is nothing developed as such. Grossly, their symptoms are mentioned. We need to. That's what that survival, that palliative performance scale, as I said. One scale I had shown here. That is not made by me only. It is not somewhere published. So like that we can do. I have shown. With the development of such scales, we can have that scale used for such type of, as you said about survival duration, we can do. Ayu Pariksha we can do. We can develop some scales in that same way. Maybe taking the help of that palliative performance scale. With that we can also develop our own scale. Nothing is readily available for Ayurveda. Modern it is available.
So positive signs you said for Arishta. Like Arishtas are only negative signs, or like I just wanted to.
So I tried to explain it here for some positive contributions also, because it is not only about, that's why in the initial time only it is not about the when the death comes. It is about the survival duration we said. That is one thing. Second thing is, it is not just about negative things. There are so many positive things also. That
Positive things are Arishtas?
positive things are Arishta means?
Like you said, sir, positive.
No, they are not Arishtas. They are good omens also. So, Prashasta Duta Lakshana is mentioned. No? So, such things also we have to observe. On the way also we have to observe the positive things. Why positive things we have to see? If at one point of time, if we see the Arishta, but dominantly we see the positive signs only, because it is Aniyata, prioritize the positive things instead of the negative one. If 10 signs of good signs are seen and only one Arishta Lakshana, like Aniyata Arishta Lakshana is seen, why are you prioritizing that one? Prioritize this one. Because it is Aniyata anyways. If it is Niyata, if it is Purusha Ashrita produced by doshas only, then we should be careful. If it is Aniyata, then look for good signs. If good signs are seen dominantly, you prioritize that one instead of seeing the good things, bad things. Sir, you are asking. Asanna lakshate chaya bhastvarna prakashini, you know that. If the person is, see, if people are sitting here, if any one face is very bright and I can easily recognize one person. Imagine. This is asanna lakshate chaya. Chaya is that one. If those 5 people or 10 people are coming from a long distance and from here only I can recognize one person, how bright the person is. That is the prabha. Chaya is seen only if these people who are glowing sitting here, if they go far away, they may not be distinctly observable, because that is prabha they may not have. Chaya they have, of course. And all these are because of the Agneya Amsha of the body. That is the ojas and all, we have it. And Agneya Amsha of the body will be making that, that prabha also it is of so many types. No? Chaya, I have got many types. Nabasi, Parthiva, so many types of food. And it doesn't depend on the skin color, definitely. A person who is fair, the person who is dark, both have chaya, both have prabha. A person who is dark skinned, the person, 10 people are coming from a long distance, from 100 meters, I can recognize one person distinctly, who is dark skinned of course, but he is glowing from there. That is prabha. When they are coming and sitting here, nearby, I can recognize the face with glow. That is the chaya. Chaya and prabha are the one which, as a bishop you can see. Prati chaya is the one which patient sees. When he sees the reflection, if he sees it is ulta. Doctors will not be seeing the ulta. If doctor sees ulta means he is angry. Patient should be seeing that. It is ulta means, that is pratichaya related.
Sir, how is it possible for the Vaidya to differentiate between Rishtabhasa and actual Arishta?
It is the one which is confusing, madam, actually. It is, that's why we have to continuously be observed, and we have to monitor the patient only. Rishtabhasa, it is because of that confusion it will create. And we don't have much description regarding Rishtabhasa. It looks like Arishta, but it turns out to be the patient will survive after that. You have announced that he won't survive for 3 more days. That patient started walking around, he started preparing for going back home, and you will be like, this doctor doesn't know anything. So we should be careful regarding Rishtabhasa. That's why we should not declare it if we have observed it. What if it turns out to be Rishtabhasa? Not much information is available regarding Rishtabhasa. To differentiate, how to differentiate whether it is Arishta or Rishtabhasa, we don't know. That is not given. That's why initially we should not declare it. It looks so, but we are trying. Like that, very safe answers they give. Doctors give, no? They don't declare it directly. We are trying. So I can't say anything. Can't say anything for 24 hours. They say. They don't declare it openly. Like that. Was that useful? So I tried to make it little different than conventional reading of Indriyasthana. I tried to give it in a different way. So that's why I didn't describe everything about what is the Varna related, Swara related Arishta. Those descriptions are anyways available. So try to give it in a different way. Hope it was informative. Sir.